Hello, I am Dr. Jennifer Lang, host of Nursing Health Today. Did you know that according to the Women's Journal of Health, osteoporosis affects 1 out of every 2 women? That's 50%. Today we're joined by a special panel of clinical nurse leaders to discuss this ongoing health issue. I also want you to welcome our guest, Mrs. Johnson, who's with us here in the audience today. She is 70 years old, smokes, and does not engage in physical activity. She also does not believe she is at risk for osteoporosis, but I'm here today to try to convince her otherwise.
I can't get osteoporosis.
Yep. So let's introduce the audience to our CNLs. We have Noelle, Alex G, Alex O, and Simona. Welcome. So I want to start today with discussing the recommended screening guideline. Let's start with you, Alex. What can you tell me about who should get screened?
Well, at the USPSTF, we recommend that all women above the age of 65 should get screened. Also, women who are younger than 65 years old but who have a fracture risk that is equal to or greater than that of a 65-year-old white woman with no additional risk factors. This is what we call a grade B recommendation. Right now, there is no recommended interval for screening.
I want to point out that this recommendation applies only to older adults who do not have osteoporosis or a history of fractures.
And the gold standard for the screening procedure is a DEXA scan, otherwise known as a dual energy X-ray absorptiometry. The DEXA scan gives a bone mineral density measurement called a T-score.
Interesting. So what can you tell me about how this screening reduces mortality and morbidity?
Well, Dr. Lang, research shows that benefits of screening are inconsistent. The USPSTF states that there is an absence of direct evidence that osteoporosis screening reduces fracture-related morbidity and mortality. However, the American College of Preventive Medicine states that there is a potential benefit to screening for osteoporosis.
Yes, and as Noelle mentioned, the evidence is not clear, but we still want to highly encourage people to get screened. And right now the evidence shows that very few people are actually doing so.
So let me get this straight. So you're saying that even though there's controversy, it's still important to get screened?
Exactly.
I'm curious though, how likely is it that someone like Mrs. Johnson will actually follow through with the screening?
Sadly, the number of people that get screened for osteoporosis is quite low. A study by De Jesus and his research team in the Journal of Population Health Management found that the screening rate for osteoporosis was between 12 and 56%.
And certain groups are even less likely to get screened than the general population. This includes people who are 80 years or older, people with dementia, people that don't have health insurance, and people that have inadequate social support.
We know that money plays a huge role in whether or not people get screened. White, married women with access to healthcare, for instance, have higher rates of screening than minority groups. They are 50% more likely to get screened. Unfortunately, certain groups that may be most in need of screening, like lower income groups or those who fall into the old age category, are not being screened. Something has to change.
Mm-hmm. And we also know, Dr. Lang, that in addition to white, married women, women in other groups, like those who have cancer or rheumatologic disease, are more likely to get screened. So it's possible that having a chronic health condition may actually increase the importance that people place on getting screened for other diseases like osteoporosis.
You know, I had no idea that there was such a disparity in the screening rates. I think that this is very important for the audience to understand. What can you tell me about some of the limitations and risks of using the DEXA scan to screen for osteoporosis? What are some of the controversies behind the screening procedure?
Well, Jennifer, first off, there's a lack of evidence about how often people should be screened and whether repeated screening is necessary in women with normal bone mineral density. And there is a discrepancy in a screening guideline of the different organizations like the World Health Organization, USPSTF, and National Osteoporosis Foundation. The benefits of bone mineral density screening on osteoporosis outcomes are controversial.
Secondly, I want to point out that the precision of the DEXA scan itself is limited. A minimum of 2 years may be needed to reliably measure a change in bone mineral density, and the DEXA scan may not accurately detect all of these changes.
The DEXA scan also has some risks associated with it. Lionel et al. In 2009 demonstrated some of these risks, which include, well, some patients develop anxiety after being diagnosed. False negative results or misdiagnosis can cause missed treatment opportunities. There is also potential for harmful radiation exposure when using the DEXA scan.
So with all these risk factors, I'm wondering what is the prevalence of adherence to the guideline?
In the U.S., osteoporosis is underdiagnosed and undertreated. One study showed that more than 90% of women believed that having a discussion about osteoporosis and fracture prevention was important, but only 44% actually had a discussion with their doctor. Also, 50% of women 65 years old, only 65% of women 65 years old had received a BMD test.
So you're saying that even though many people believe that screening is important, very few are actually following through with the screening?
Yes.
Am I getting that right?
Yes.
Is there a theory that you use in nursing that can help explain why so few people are getting screened?
Yes, there is. The model that we follow is called health belief model. It helps us explain why people do not engage in certain health prevention behavior like screening.
To give everyone an idea of how the health belief model is constructed, it's made up of what are called constructs. An example of one of the constructs is perceived susceptibility, which is the person's belief about whether or not they will get osteoporosis. The issue of perceived susceptibility can be addressed by helping the patient see their actual risk of getting the disease.
To add on to what Alex and Simona have said, another construct of the health belief model is perceived barriers, which are the barriers that the client believes stands in the way of getting screened. If the patient sees more barriers than benefits, then they will be less likely to get screened, and therefore less likely to receive necessary treatment. As nurses, we can help patients like Mrs. Johnson overcome some of these barriers.
So just so I could get a better understanding, can you give me an example of how you might use this theory to just describe the increased adherence in a patient like Mrs. Johnson?
Well, we might address the issue of perceived susceptibility, for example, by helping her see that she is in fact at risk of getting osteoporosis because she is female, she is older than age 65, and she has a small frame.
We can also address the issue of perceived barriers with her by doing things like offering her reassurance, correcting any misinformation she might have about osteoporosis, and providing assistance when she needs it. By doing all of these things, we can help her see that the benefits of screening outweigh the costs.
CNLs should educate all patients about the risk factors for osteoporosis and encourage screening if they are at risk for the disease. Berarducci stated that awareness is key to the prevention and early detection of osteoporosis. We have provided a list of educational public resources for the audience today. The camera will zoom in on some of them.
Yes, so as you can see, there are a number of valuable resources that patients can look at. I want to point out a couple. I recommend going onto the National Osteoporosis Foundation and the USPSTF websites. Also, I want to focus for just a second on the FRAX website. Now, this is a website that patients can go on and they can calculate their 10-year risk of developing a fracture. And this is can give them a good idea of whether or not they should go in and see their healthcare provider.
CNLs should not only give patients resources, but they should also make referrals, whether it be to a physical therapist or to a nutritionist, because interdisciplinary collaboration is key. We should educate patients about the importance of not smoking and drinking, and the importance of consuming enough vitamin D and calcium to help support bone health.
So there are some ways to increase patients' adherence to the guideline. What can you tell me about strategies that CNLs can use to convince healthcare providers to increase the delivery of the screening recommendation?
According to the American Geriatric Society, one effective strategy that nurses can use is encouraging preventative health exams. Studies show that elderly female patients who complete preventative health exam have extraordinarily high rates of osteoporosis screening, more than 96%.
It's true. It's important for patients to receive regular health exams. It's also very important for doctors to introduce and abide by screening guidelines. I can't emphasize this enough. We need to re-educate healthcare providers about the severity of osteoporosis. Not enough healthcare providers are discussing this issue with their patients.
According to a study by Lionel in 2009, the percentage of healthcare providers that ordered DEXA screening tests for postmenopausal women was less than 62%. Ideally, we want this number to be a lot closer to 100%.
I know that the screening guidelines are being adequately addressed by physicians. What can you tell me about some of the social and environmental policy implications of the current screening guideline?
Well, in terms of social barriers, because we're dealing with an elderly population, we want to address the issues of social stigma and ageism. As stated earlier, people over 80 are less likely to be screened. This may be due to their fear of losing their independence and not wanting to be a burden on others.
In terms of environmental barriers, the cost of screening seems to be a big problem. Some insurance companies do not cover osteoporosis screening, and Medicare and Medicaid reimbursement rates have gone down, which impacts patients' ability to get screened.
Convincing insurance companies to implement a policy change is a long process that requires getting a lot of support, specifically from policymakers. Writing a letter to Insurance Commissioner of California might be one way to make a change. In the letter, we can demonstrate that the positive net benefit to osteoporosis screening and the amount of money spent is less than the amount that is saved.
I know we're almost out of time, but I want to finish by saying that joining organizations is another great way to help address some of these social and environmental barriers. For example, nurses might consider joining the American Geriatric Society to advocate for the improved care of elderly patients.
Great. Well, that concludes our show for today. I will post some of these organizations on our website. I want to thank you so much for coming. To sum up what we talked about today, we discussed the importance of screening for osteoporosis in women 65 years and older, as well as the importance of addressing risk factors for osteoporosis. We also discussed ways to improve adherence to screening. I'll see you next time. Tune in next week to view the next episode of Nursing Health Today.
Okay, maybe I'll go get screened.